Hello, classmates of Nursing 330. This is Tia Townsend, RN, coming to you with our discussion post for week 2. This week we are talking about virtual nurses and telehealth. So first off, I am going to start by discussing what those things are. So a virtual nurse is a nurse that is on the end of some sort of technology, whether it be a phone, your computer, an iPad. There's a certain way to get a hold of this nurse, and then they are on the other end of technology, but they are not technically in the room or at bedside with you. So telehealth is receiving of healthcare services that are rendered through a technology source, such as your iPad, phone, or computer. Some of these can be done on just phone calls. Some can be done with video. And we're going to talk about the positive and negative aspects of both of these. So let's first talk about a virtual nurse. Some areas in the United States have implemented virtual nurses along with their bedside nurses. An article I found on the American Nurses Association website talks about how the virtual nurse was implemented in a hospital as early as 2019. They have modified it quite a few times, but as the end result, it has helped both the hospital and the nurses overall. So what a virtual nurse offers in the realm of healthcare is someone there that's 24/7, that you can pick up the phone, pick up your device, and call them with any questions, any concerns, any new symptoms, and they will be able to help you and guide you through that, or get a hold of your healthcare provider if they feel like it's necessary for you to speak with them. Another positive aspect of the virtual nurse is it does keep our really nice, seasoned, experienced nurses in the workforce. Some of these nurses, they do age. We can't avoid aging. But these experienced nurses that can't no longer do like the physical aspects of the nursing job can still find value and be a great asset for hospitals and nurses worldwide with having this virtual nurse there. It can be a virtual nurse for the nurses on the floor. It can be virtual nurses for the patients, but we are able to keep that experience going throughout the healthcare system. Another aspect that is a positive one is that it has seemed to decrease the workload of the bedside nurse, from admissions to discharge education to just answering the call light if they have a question about their TV, or simply they need to go to the bathroom. That virtual nurse is able to radio the bedside nurse while also taking some of the load, especially documentation workload, or even if it's like a one-on-one patient that needs someone to have eyes on them all the time. A virtual nurse is going to be a great asset in that aspect. Some negative components of a virtual nurse is, with technology always changing, it can be difficult to start up a virtual nurse program at a hospital. It can be very costly, trying to get new technologies integrated into older systems. Another issue is if these nurses are not based locally for their local system, they'll have a very limited geographical knowledge of the area. So there's kind of a hindrance for those nurses, especially if they aren't familiar with those areas. They can't really help direct them to like emergency care services and things like that if they don't have location services available through their devices. So moving on to telehealth. It also has some really positive aspects, such as getting people access to care and also decreasing the cost of that care by decreasing gas that's needed to get to appointments, babysitting that take place through appointments if you have children, those types of things. Some types of disorders do need a hands-on care approach. Sometimes situations and illnesses or diseases are really volatile and they really do need constant care. Those type of aspects are definitely going to need to be in like a hospital setting, bedside setting, where people are there 24/7 to definitely monitor their condition and the deteriorating of those conditions. It has decreased the cost of healthcare. Like I said, it also helps decrease the wait times for healthcare. If you have someone that's at the on the end of your device instead of having to go and sit and wait for 2, 4, 7, 12 hours at an ER just to get an answer that you're having indigestion. I mean, that's gonna really decrease the cost for everyone overall, and it's also gonna decrease the wait time, which is going to increase patient satisfaction and patient outcomes. Now, something that can negatively impact healthcare with telehealth is people that have limited cell phone service, limited Wi-Fi service. They're not going to be able to access this, so it's still leaving people, certain areas, certain demographics and populations without affordable, accessible healthcare. It can make the assessment more difficult, especially if you're over the phone. You're not seeing the patient, you're not looking at the patient, you're not watching their color change or their heart rate or anything like that. You're basically just going off the information that they're giving you, and that you're asking for, that you know to ask for. So that can really cause a decrease in good outcomes if we're not having a really good assessment on those patients that really need one. Something else that we're concerned that it might slow down the seeking of emergency services when they're needed. This is really going to be on the backs of nurses to help with this in the telehealth world, is we're going to have to really hone our assessment skills a lot to know exactly what those patients need so we can send them to the appropriate level of care when they need it. So I think definitely in the future, healthcare is definitely heading the way to telehealth. I mean, we're going to be able to reach our doctors and nurses at the touch of a hat here very soon. That's just the way our healthcare is going. We definitely do need to be up for change in this new environment. We need to be able to take criticism, take constructive criticism. We need to try new things, try new abilities, see what we're able to do. Try not to get stuck in that, well, this is the way it's always been. We definitely need to reach out and grab those chances for change. Thank you for listening to my discussion. I hope you guys have a great evening. Thanks.